Question 1. A provider has ordered meperidine, Demerol, 50 mg IM for a client in active labor. Before administering the medication, the nurse assesses the client and finds cervical dilation at 9 cm, 100% effacement, and the fetus at +1 station. What is the nurse's most appropriate action? A. Refuse to administer the meperidine to the client. Because of the risk of respiratory depression to the neonate at birth, the nurse should refuse to administer the meperidine. When meperidine is given IM, its effect will peak in 30 to 60 minutes and last 2 to 4 hours. Based on the assessment of the client, she will likely deliver within an hour. Because meperidine is classified as a narcotic analgesic, naloxone should always be available to reverse the effects of opioids. Question 2. Which of the following pediatric clients is at the greatest risk to develop pediatric acute respiratory distress syndrome, PARDS? A. A child with a drowning experience. Pediatric acute respiratory distress syndrome, PARDS, occurs when fluid fills the lungs due to an infection or injury. Acute respiratory distress syndrome, ARDS, is a major complication caused by aspiration of water upon and NBSB, drowning, in which permeabilities of the and NBSB, lung and NBSB, alveolar and capillary walls increase, resulting in exudates in the alveoli that cause hypoxia unresponsive to oxygen therapy due to and NBSB, lung and NBSB, injury. While pneumonia can lead to ARDS, a temperature of 103.4 F does not provide enough information to determine if pneumonia is present. Congenital heart defects must be monitored, but this is not the condition most likely to cause ARDS. A leg fracture is a risk for pulmonary embolism, rarely associated with ARDS. Question 3. An unlicensed assistive personnel, UAP, who works in a rehab unit is floated to the pediatric unit for the shift. Which question should the charge nurse ask the UAP before making an assignment? C. Can you wait a minute so we can review your competency checklist? The UAP must be competent to accept assigned tasks in any unit. The most objective and comprehensive way to determine the UAP's skill set is to use a checklist developed by the hospital or healthcare corporation. The length of time at the facility, comfort level in pediatrics, or favorite types of clients are not appropriate ways to make assignments. Question 4. Performing a non-emergency invasive procedure on a client without first obtaining informed consent can be considered. B. Battery. In medicine, battery and NBSB is the and NBSB, intentional denial of and NBSB, a patient's right to direct their own medical treatments. And NBSB, informed consent must be obtained from the patient before giving non-emergency treatment. If medical treatment is performed without the patient's consent or against the patient's will, the patient may have a claim for medical battery, even if the doctor did not intend to cause any harm. Question 5. Which of the following findings is consistent with a diagnosis of portal hypertension? A. Abdominal distension. A. Abdominal distension. Portal hypertension is abnormally high blood pressure in the portal vein, the large vein that brings blood from the intestine to the liver, and its branches. The portal vein receives blood from the entire intestine and from the spleen, pancreas, and gallbladder and carries that blood to the liver. Symptoms of portal hypertension include abdominal distension secondary to ascites, esophageal varices, black, tarry stools secondary to GE bleeding, splenomegaly, and hepatic encephalopathy. Platelet and white blood cell counts may be low. Gross hematuria is not indicative of portal hypertension. Question 6. As the nurse prepares to witness the surgical consent for a patient undergoing a craniotomy for glioblastoma, the nurse assesses the patient's understanding of the procedure. Because the nurse is the patient's advocate, which statement by the patient would cause the nurse to contact the surgeon before the patient signs the informed consent? C. There seem to be no major risks from this surgery. Obtaining an informed consent requires that the patient first be informed about the risks of the procedure. Surgery always involves both surgical and anesthesia risks. Other components of informed consent include potential complications, expected benefits, the surgeon's inability to predict the exact outcome, and other treatment options. The other responses to this question are appropriate and indicate understanding. Question 7. The nurse manager notes that a staff nurse has been tardy 3 times in the last 2 weeks. Which of the following should the nurse manager do first? A. Ask the nurse to meet privately. The nurse manager should first meet with the nurse in a private setting to find out why the nurse has been late and to review the attendance policy. Then the nurse manager can document the meeting for the staff nurse's employee file. If tardiness continues, the nurse manager should follow policy. Signs or reminders and staff meetings are neither useful nor effective. Question 8. The nurse in a medical surgical unit may allow all of the following people to view a patient's medical record except C. An ED nurse who wants to know the patient's current condition. The nursing instructor, researcher, and healthcare power of attorney may have access to the patient's medical record. The emergency department nurse who is interested in the patient's status may not view the chart. Patient information is strictly confidential. Only those who are directly involved with the patient may have access to the record, and then only enough information that is necessary for their tasks. Without consent from the patient or the patient's power of healthcare attorney, even the spouse or family members may not obtain information. Question 9. After being promoted to nurse manager, a nurse realizes that he is having problems with time management. After his mentor makes several suggestions, which technique should he implement first? A. Keep a time log of activities for 1 week. The new nurse manager should start by assessing how his time is currently being spent. Keeping a time log of all activities for a week will show how time is spent and how tasks can be better prioritized. The other suggestions may be useful going forward, but they are not the priority. Question 10. As a preceptor, the RN helps a graduate nurse learn to organize and prioritize tasks. Which action by the graduate nurse requires intervention by the preceptor? B. The graduate nurse waits to document until the end of the shift. The graduate nurse should learn to document throughout the shift. Time management is essential for nurses. Taking advantage of every opportunity to record client updates is efficient and also wise from a legal and risk management perspective. The other actions are appropriate for a graduate nurse. Question 11. The nurse is measuring the intake and output of a client with a diagnosis of viral pneumonia and a temperature of 102.4 degrees Fahrenheit. Because of NPO status, the client is receiving 4 fluids. When planning care for the client, what should the nurse consider first? B. Body fluid being lost from the lungs and skin. Insensible fluid loss is the amount of body fluid loss that is not easily measured, from the respiratory system, skin, and water in the excreted stool. Insensible fluid loss is a factor in regulating body temperature. Fever will increase metabolism and fluid loss. With and NBSB, fever, each degree above 98.6 degrees Fahrenheit, 37 degrees Celsius, adds 2.5 milliliters per kilogram per day to and NBSB, insensible fluid loss. The other answer options are not related to the client's intake and output. Question 12. As the nurse determines which tasks to delegate to unlicensed assistive personnel, UAP, which of the following tools is most appropriate? A. Standardized checklist. To be objective when delegating tasks to UAPs, the nurse uses a standardized checklist that indicates the training and skills needed to safely provide client care. Rotating assignments among UAPs may not be appropriate if they are not equally experienced or certified. Feedback from other staff members is not valid or appropriate. Personality inventories are not used for delegation. Question 13. Which of the following actions occurs during the evaluation phase of the nursing process? A. Examining outcomes. During assessment, the nurse collects data and uses critical thinking skills. Diagnosis includes using clinical judgment to plan and implement patient care. The planning stage is where patient-specific goals and outcomes are formulated. Implementation involves putting the nursing interventions into practice. Evaluation is the final step, in which the nurse determines whether outcomes were met. Evaluation is a continual process, with the care plan being modified as needed. Question 14. Which ethical principle is used when a client asks about her prognosis? B. Veracity. Veracity is the ethical principle that means to tell the truth. There can be no mistruth or deceit. Beneficence is the duty to do good and promote kindness. Fidelity is being faithful and keeping promises. Non-maleficence is the duty to prevent harm and not to harm. Question 15. The nurse is supervising a new LPN. Which of the following is the best way to determine whether the LPN performed an assigned task well? C. Follow up after the task is completed. The nurse should follow up with the LPN as soon as the task is completed. Timely feedback is most effective for adult learners. Referring to a checklist does not provide timely feedback or an opportunity to teach. Professional behavior is expected of all staff. Asking others for their opinions is not appropriate. Question 16. As client advocates, nurses can refer clients when they recognize a need. At which stage of the nursing process does the need for a referral become evident? A. Assessment. A referral is a way for a nurse to connect with another healthcare team member, with the goal of meeting the client's perceived need. Referrals take place during the first stage of the nursing process, assessment. An example is a school nurse who refers the parents of a child with a speech problem to a speech therapist. Another example is a community nurse who gives a teen contact information for free birth control. In an acute setting, the nurse may contact social services to assist with homelessness or substance abuse treatment. Question 17. Before a nurse formulates a nursing diagnosis, what is the first step? C. Perform an assessment. Assessment is the first step of the nursing process. Goals and objectives are based on the assessment and the diagnosis. After that, a nursing diagnosis can be made. Next, interventions are determined by the goals and objectives. Finally, an evaluation takes place to see if interventions were successful. Question 18. Which of the following is an appropriate assignment that a nurse can delegate to an unlicensed assistive personnel, UAP? B. Obtain a clean catch urine specimen. An appropriate task for a UAP is one that the UAP has the training and skills to perform and is within the UAP's scope of practice. The UAP can safely obtain a clean catch urine specimen. Administering a nebulizer treatment or monitoring a blood transfusion are outside the UAP's scope of practice. While the UAP can measure vital signs, the nurse should assess the client during the immediate post-op phase, including the taking of vital signs. Question 19. A nurse is preparing a client for a left below the knee amputation. Which of the following is the priority for the nurse? B. The client has more questions for the surgeon. The nurse should notify the surgeon that the client still has questions regarding the procedure. The nurse may clarify facts, but the provider is responsible for explaining the surgery and giving detailed information. The client has correctly identified the site, and is free to refuse blood or blood products. Meeting with a physical therapist is not the priority. Question 20. The nurse works with the Head Start Early Childcare Program, visiting several program sites to monitor and coordinate health services for the children. During the past few months, the nurse has noticed that one child has had a broken arm and a black eye. This time, the child has red marks on their cheeks and arms. The nurse suspects child abuse. What is the nurse's best immediate action? A. The nurse should contact the state child welfare agency at once. Nurses are mandated to report suspected or known instances of abuse to children, elders, or dependent adults. State laws may vary regarding what to report, but generally the nurse documents objective evidence, not opinions or feelings. The sole responsibility is to report a suspicion and provide the facts. The investigation is conducted by proper authorities. Not reporting suspected abuse can result in disciplinary action against the nurse. Questioning the child is not the best action. The child may lie to protect the perpetrator. Telling the director must be done, but is not the best immediate action. Question 21. The RN is making assignments for the shift, with a team of an LPN and a CNA. Based on license and scope of practice, which of the following patients is most appropriate for the LPN? B. A patient who had a mastectomy yesterday. When making assignments, the RN should consider licensure, job descriptions, scope of practice, and state law. In this case, the LPN should be assigned the post-operative patient. An unlicensed assistive personnel, UAP, such as a CNA can provide care involving assisting with activities of daily living, ADL, or non-invasive care such as working with a patient with a diagnosis of dementia or Alzheimer's disease. Question 22. After a healthcare provider, HCP, leaves the hospital unit, one nurse comments to another, "I wouldn't go to that HCP for anything. They're a complete idiot." What legal violation could the first nurse be charged with? A. Slander. Slander and libel are types of defamatory statements. Slander is a defamatory statement that is oral. Libel is a defamatory statement that is written. Assault is defined as any intentional act that causes another person to fear an attack or imminent physical harm. Abuse is improper treatment of someone by harm, violence, force, or cruelty. Question 23. After completing the interviews for a staff nurse position in a busy medical unit, the nurse manager recognizes that the most qualified candidate has disclosed a need for accommodation related to a sensory impairment. What is the nurse manager's most appropriate action? B. Determine what types of accommodation the candidate requires. The Americans with Disabilities Act, ADA, mandates that individuals with motor, cognitive, psychiatric, or sensory impairment receive equal access to employment opportunities. Employers must evaluate each applicant's ability to perform the job on a case-by-case basis and cannot legally discriminate on the basis of a disability. According to the ADA, during the application stage, employers are not allowed to ask medical questions and applicants are not required to disclose their disabilities unless they need an accommodation. If the nurse has not disclosed a disability, then once an employer makes a job offer, but before the new hire actually starts working, employers can ask any medical questions they want as long as they ask all new employees in the same job category the same questions. At this stage, the new hire must disclose a disability if asked. The other answer options could be illegal and discriminatory. Technical Assistance Manual for Title I of the Americans with Disabilities Act, ADA, January 1992. Question 24. When admitting a client with cardiac tamponade, which finding will be consistent with the diagnosis? C. Distended neck veins. Distended neck veins, due to rising venous pressures, are a hallmark sign of cardiac tamponade. Cardiac tamponade is usually the result of penetration of the pericardium, the thin, double-walled sac surrounding the heart. When blood or other bodily fluids enter the sac and compress your heart, blood return to the heart is severely restricted. Other signs include hypertension, anxiety, restlessness, tachycardia with muffled heart sounds, tachypnea, dyspnea, and chest pain that radiates to the neck, shoulders, and back. Question 25. When using Maslow's hierarchy of needs to plan care for a client, which level is the priority? C. Physical. In Maslow's hierarchy of needs, physical, or physiological, needs are what are required for survival, such as food, water, and sleep. These are universal human needs. Safety needs are the requirements for security, shelter, jobs, health, and environment. Social needs are the human requirement for feelings of belonging and intimacy. Status, or self-esteem, is the need for recognition and respect from others. The final level is self-actualization, the realization of one's full potential. Question 26. Because of a staff shortage, a nurse with only 6 months of experience is pulled from his surgical unit to a medical unit. Which patient assignment is most appropriate for him? B. A 72-year-old who requires instruction on using an incentive spirometer. When a nurse is pulled, or floated, to a different unit, the nurse should be assigned patients that are compatible with their experience. In this case, the nurse should be assigned the patient who needs instruction on using an incentive spirometer. Many surgical patients are taught about coughing, deep breathing, and use of incentive spirometry preoperatively. To care for the patient with TB in isolation, the nurse must be fitted for a high-efficiency particulate air (HEPA) respirator mask. The bronchoscopy patient needs specific post-procedure care, and the ventilator-dependent patient requires a nurse who is familiar with ventilator care. Question 27. The nurse in a surgical unit is making assignments for the shift. Which task is appropriate for the unlicensed assistive personnel, UAP? C. Apply TED hose and ambulate in the hall. Many of the tasks that a UAP can do involve activities of daily living, ADLs, such as personal hygiene, shaving, bathing, oral hygiene, hair care, and toileting, assisting with dietary needs, and measuring vital signs. Under some circumstances, a UAP may be allowed to change a dry, non-sterile dressing. Assessments are the responsibility of a licensed nurse. Question 28. A nurse watches a new nursing assistant care for a post-stroke patient with left-sided paralysis. Which action by the nursing assistant requires the nurse to intervene? C. The nursing assistant tries to move the patient up in bed by placing a hand under the patient's left axilla. The nurse should intervene because it is not appropriate to pull a patient up in bed by the patient's armpits. Attempting to pull on a flaccid shoulder joint could cause shoulder dislocation. Always use a lift sheet for both patient and staff safety. All the other actions are appropriate. Question 29. While transcribing a physician's orders, the unit secretary asks the nurse to decipher an illegible medication order. What should the nurse do? B. Clarify the medication order by calling the physician. It is always the responsibility of the nurse to accept, verify, and administer orders. For example, the Massachusetts Nurse Practice Act includes the following statement on the topic: in any situation where an order is unclear, or a nurse questions the appropriateness, accuracy, or completeness of an order, the nurse may not implement the order until it is verified for accuracy with a duly authorized prescriber. Question 30. A client has been transported to the pre-op area when the surgical nurse discovers that the client has not signed the informed consent. What is the most appropriate action for the nurse? A. Notify the nurse manager of the situation. If there is no signed informed consent form, the nurse should notify the nurse manager, who can speak with the surgeon. The surgeon is responsible for the informed consent process. If the client has already been given a pre-op sedative, it would be unethical to obtain a signature from the person. The nurse should not contact the surgeon directly or ask for the procedure to be rescheduled. Question 31. For a nurse to renew or maintain a nursing license, many state boards of nursing require proof of continuing education. Which type of law is this? A. Administrative. Administrative law regulates the operation of government agencies that oversee administrative matters, such as state boards of nursing. Statutory law is law passed by a legislative body, such as a state legislature. Constitutional law is based on the United States Constitution. Common law is based on legal case precedents. Question 32. If a patient asks to see her chart, what should the nurse do? A. Give the patient her chart and answer her questions. The patient has a right to see her chart. As the patient's advocate, the nurse should answer any questions and encourage the patient to become part of her healthcare team. The Bill of Rights for Patients has been in place since the 1960s. Every patient should be aware of their rights. Question 33. The nurse is reviewing the healthcare provider's HCP admit orders for a client with a diagnosis of gastroesophageal reflux disease, GERD. The HCP has prescribed omeprazole daily, Maalox AC, acid reflux diet, and the bed to be maintained in Fowler's position. Which order should the nurse clarify with the HCP? B. Schedule for Maalox. The nurse should question the order for Maalox before meals. It is usually taken after meals and at bedtime. Omeprazole, Prilosec, and NBSB is used to treat certain and NBSB, stomach and NBSB, and NBSB, esophagus and NBSB, problems, such as and NBSB, acid reflux and ulcers. It works by decreasing the production of stomach acid. It relieves symptoms such as and NBSB, heartburn, difficulty swallowing, and persistent and NBSB, cough. This and NBSB medication and NBSB helps heal acid damage to the stomach and esophagus, helps prevent ulcers, and may help prevent and NBSB, cancer and NBSB, of the esophagus. Omeprazole belongs to a class of drugs known as proton pump inhibitors, PPIs. It is usually prescribed daily for adults. The other orders do not need to be clarified. Question 34. Which of the following is included in the safety level of Maslow's hierarchy of needs? B. Laws. The second level of Maslow's hierarchy of needs is safety, which includes structure, security, and limits. People want to experience order and predictability in their environments. Job security, schools, laws, law enforcement, businesses, and medical care are examples of this level. Clothes and sex are in the first level, physiological. Friends are in the third level, love and belonging. Question 35. A 22-year-old with terminal brain cancer tells you that she has an advance directive for her end-of-life care. You know this can mean any of the following except A. Her family can direct the staff to keep her alive. Advance directives describe the kind of medical treatment you want for yourself if you are in serious health condition or unable to speak for yourself. Anyone over age 18 can have an advance directive. Once in place, it is a legal document that cannot be revoked. A person can choose to have a living will, which lists the person's wishes regarding end-of-life care. The person can also designate someone who can make medical decisions if the person is unable to. This is called a medical power of attorney. A person can also indicate a wish to be a DNR, or do not resuscitate, patient if the person's heart stops beating or the person stops breathing. Question 36. Knowing they only have a short time to live, a client with metastatic cancer refuses pain medication. The client states that the drugs make them sleepy and they prefer to be awake and with their family until they die. The nurse can see that the client is suffering and decides to slip the client pain medication without their knowledge or consent. Which of the following values did the nurse use to administer the medication? C. Paternalism. In paternalism, a decision is made without the knowledge or consent of the client, in the client's best interest. This action violates the ethical principle of autonomy, the right of competent adults to make informed decisions about their own medical care. Non-maleficence is the ethical principle of do no harm. Beneficence is the ethical principle of supporting and doing what is good for a client. Confidentiality refers to the principle of keeping secure and secret information from others, information given by or about an individual in the course of a professional relationship. Question 37. After a conference with the family, a patient's care provider writes a do not resuscitate, DNR, order. What does the nurse understand when planning care for this patient? B. Nursing care will continue with the treatment orders in place. A DNR order only controls CPR and similar life-saving treatments. All other care and treatment should continue as ordered. Competent patients can still decide about their own care, including whether to rescind the DNR order. A new DNR order is written with each hospitalization. Question 38. An LPN/LVN works on a busy medical surgical unit as a team member with the RN and two unlicensed assistive personnel, UAP. The RN is responsible for ensuring that orders from the healthcare provider, HCP, are carried out. Which of the following tasks is not appropriate for the RN to assign to the LPN/LVN? A. A. Administer full push drug for a client's rapid atrial fibrillation. The LPN/LVN is generally permitted to administer routine medications and drugs that have a slower action. RNs administer high-risk drugs. The LPN/LVN may generally administer oral medications. Digoxin should be withheld for an apical pulse until T, 60 bpm. Insulin may be administered by an LPN/LVN, with a focused assessment before and after giving it. The CDC approved administration of COVID-19 vaccinations by an LPN/LVN. Question 39. When a patient refuses treatment, this is an example of C. Common law. Common law allows a mentally competent adult to refuse medical treatment, even if it hastens the person's death. Also called case or precedent law, it's based on past cases of a similar type. Individual cases contribute to the precedents for resolving a legal conflict. The right to refuse treatment is based on U.S. cases from 1891 and 1914. In the case Sklondorf v. Society of New York Hospital, 1914, the New York Court of Appeals ruled, every human being of adult years and sound mind has a right to determine what shall be done with his own body. Question 40. The PDCA cycle is a quality improvement method of implementing change. Which of the following steps is incorrect? D. A equals access. In healthcare, the PDCA cycle is Plan Do Check Act. Plan is the first step, to determine what to change. Do is the second step, to implement the change. The third step is check, to compare the change to baseline. Act is the final step, to make the change permanent and continue to monitor. Question 41. A nurse on the surgical unit fails to report to the provider that a client's condition has deteriorated since the client's return from the post-anesthesia recovery unit, PACU, 2 hours ago. The client is subsequently returned to the operating room for emergent surgery. Which of the following could the client use to bring legal action against the nurse? D. Tort offense. A tort offense is an act or omission that results in injury or harm to another, whether intentional or not. Most lawsuits against nurses involve tort law, situations in which standards of care were not upheld or followed. Statutory laws are enacted by federal, state, or local governments. A misdemeanor is handled by criminal law. Battery is the intentional act of causing physical harm to someone. Question 42. During a family gathering, the nurse's nephew with type 1 diabetes tells the nurse that he feels sweaty and shaky. Which of the following actions by the nurse is the priority? D. Give a glass of orange juice. Hypoglycemia is a common adverse event in people with type 1 diabetes. Early symptoms are sweating, shakiness, and hunger. If not recognized and treated, the person may experience weakness, trouble walking, and blurry vision. Severe hypoglycemia is indicated by fainting, confusion, seizures, and loss of consciousness. A level between 55 and 70 mg per deciliter is mild to moderate hypoglycemia. If levels drop below 55 mg per deciliter, a person with type 1 diabetes may experience severe hypoglycemia. When first symptoms appear, give 15 grams of fast-acting carb, such as orange juice, hard candy, or glucose tablets. Check blood sugar, if possible, 15 minutes later. It is important to check, but not the first priority. Administering insulin will cause the glucose level to drop even more and can be fatal. Transport to the hospital is not indicated. Question 43. A hospitalized client has developed a postoperative complication. The nurse case manager contacts the client's third-party pair about extending the client's stay. This is called D. Concurrent review. When the nurse case manager contacts the third-party pair, insurance company, during a client's inpatient stay, the nurse is seeking to review the current treatment, costs, and plans for what the client still needs. This is called a concurrent review. It is a standard process during hospitalization. Prior authorization, sometimes called pre-authorization, is a requirement from a client's health insurance company that their doctor obtain approval from the client's plan before it will cover the costs of a specific medicine, medical device, or procedure. Retrospective review takes place after discharge, to determine coverage. Urgent authorization is not an actual term. Question 44. On her first visit to the prenatal clinic, a 20-year-old primigravida tells the nurse that her husband is unemployed and they can't afford food. Which is the most appropriate action for the nurse? D. Refer the client to a social worker for further assistance. The nurse should refer the client to a social worker who can assist with the client's needs, such as by helping the client access suitable food programs. Providing the client with budget recipes and nutritional advice does not solve the client's problem of being unable to afford food. It is not within the scope of practice for the nurse to inquire about the client's income or to suggest that she seek employment. Question 45. When assigning tasks to unlicensed assistive personnel, UAP, the nurse can ask them to do all of the following except D. Provide patient and family education. Unlicensed assistive personnel, UAP, are not allowed to give instruction or education to patients or family members. They are also not permitted to administer medications, perform invasive procedures, or perform patient assessments. They can only report what they observe, without interpretation or assessment of the situation. They are also certified to give emergency assistance. Providing education involves assessing understanding and adapting the information to meet the needs of the patient and family. Question 46. The nurse is at home with their 10-year-old son when the child falls off his bike and his front tooth is avulsed, knocked out. The nurse is able to quickly retrieve the tooth. What is the nurse's best action before going to the emergency department? T. D. Place the tooth in milk for transport to the ED. An avulsed tooth is totally dislodged from its socket. It is medical dental emergency that requires prompt treatment to minimize hypoxia and necrosis of the pulp of the tooth. Reinsertion should be done within a few hours. Do not touch or handle the root of the tooth. Rinse the tooth with saline and pack the socket with sterile gauze. The preferred storage solution is milk, with saline or saliva if milk is not available. Holding the tooth in the cheek helps keep it moist, but there is a risk of the child swallowing it, so this is not an ideal solution. Question 47. During shift report, the charge nurse notes that the unit has had a sudden increase in admissions of very sick clients. In order to balance the shift's assignments, the charge nurse will likely divide the clients according to D. Client acuity. Because more clients are very sick, the charge nurse will make assignments that balance client acuity. Acuity is the measurement of intensity of nursing care required by each client. Assignments should be equitable to prevent overload and maintain client safety while preventing nurse burnout. The charge nurse may consider staff experience and the scope of practice of all team members, but those are extra factors. Client ages are not a factor. Question 48. When a nurse is assigning a task to an unlicensed assistive personnel, UAP, which is the most important factor in the nurse's decision? D. The UAP's strengths and weaknesses. The nurse should consider the UAP's strengths and weaknesses so that the client can receive the best possible care. A UAP's experience in the unit may not be relevant to the task at hand. Which tasks the UAP prefers and where the UAP got their certification do not factor into the nurse's decision. Question 49. A staff nurse approaches the nurse manager to complain that an unlicensed assistive personnel, UAP, is not completing assignments. What is the nurse manager's best action? D. Ask the staff nurse if they have already spoken with the UAP. The nurse manager should assist the staff to manage conflict or difficult discussions directly. It's an important skill that is useful in both professional and personal areas. In this case, if the staff nurse is unable to resolve the situation, then a meeting with the staff nurse and the UAP is appropriate. Question 50. The nurse is caring for a client with a diagnosis of Alzheimer's who is agitated and combative, disrupting other clients on the unit. If the nurse administers an unprescribed sedative to calm down the client, what can the nurse be accused of? D. False imprisonment. False imprisonment is the inappropriate confinement of a client with restraints, seclusion, or a medication acting as chemical restraint, restricting the client's freedom. Assault is a threat made against a person that makes them fearful. Battery is touching a client, without their consent, that causes harm. Unintentional torts are unintended acts against a client that cause them harm, such as malpractice.